What is love
Yes,
addiction and
well,
whether it
love
exists?
addiction, it's not actually an addiction. I mean, addiction, it's not actually an addiction. I mean, addiction can be very subjective as to how you define it. I mean, if we're looking at it in terms of a chemical addiction, it is definitely not that. But that was my question going into this research. What is it? Who gets it? Can we really be addicted to love? And so my definition is that love addiction is a unconscious habit that forms as a way to meet an unfulfilled need. And usually that stems from early attachment wounding. So that can be, I'm using sex or relationships, and love addiction, by the way, can be three different subcategories. You can have sexual out of control compulsive behaviors, relationship dependency, or actually feel a sort of drive towards love, the experience of love, passion, romance, sort of the fantasy of that can become the compulsion in the relationship. So I saw it as more of this unconscious drive. And I also saw a major component in early attachment and working models of sex and love that leads to maybe distortions in how people are seeing that in their own modeling of relationships. So for example, if you had a model of love always being something that was risky or dangerous or difficult to obtain, that's a working model that you may bring into relationships. Maybe it creates avoidant attachment or difficulty opening up because it's too vulnerable and overwhelming. So I really found love addiction to be something that, yes, it can exist, but I don't use the word addiction. I look at it as more of a maybe an out of control or a behavior that has now become something that isn't providing you with comfort, but instead activating a lot of distress. I think people think of sex and love addiction as something that, oh, people are getting a lot of this euphoria or feeling of intensity, and that it's something pleasurable. But for many people that experience this, it's actually a very cyclic experience, a very short-lived pleasure that then activates a lot of shame, a lot of guilt, a lot of isolation, a lot of depression and anxiety. So I was fascinated by it. I was working in an industry, kind of the mid-late 2000s, where it was all over the place. I mean, you couldn't read a newspaper without reading about sex addiction. And in working with clients and couples, I found that they were saying most men are sex addicts, but women are love addicts. And I thought, why is that? Why are women looked at as love addicts? Can women be sex addicts as well? I mean, what is all of this? And so I started diving into books like Women Who Love Too Much and Leaving the Enchanted Forest, and all of these sort of ideas of how we see love addiction as something that can be very socially constructed. And that was a lot of the work I was doing as I provided my research, is that, yes, of course we can become consumed by love. Anything we do in our life can claim our consciousness, and love is powerful. I mean, if we think about it, it's our first emotion. It's universal. I mean, everyone knows love. Even animals experience love. So it's a powerful, powerful emotion. But if you ask maybe a group of 100 people, I imagine everyone would have a different definition of what love actually is. And I saw that even in my field of psychology. I mean, there are so many variations of how people define love, how we measure love, what are healthy sort of models of love. So it was all over the place. So when I was doing my research around love addiction, I found that there really is a lot of work to be done in understanding, love and love behavior, but fascinating in terms of how we understand our own behavior, and also the relationship and sexuality in love. I mean, that kind of gets crossed in our learning around what is, what do we really value, and how do we experience connection? Is love necessary for us to have sex, or is sex necessary for us to have love? So there's just sort of a lot of, again, mixed messaging and social conditioning around how we view love.
And in your field with experts like yourself, is there more of an acceptance or pushback with like the love addiction term compared to the sex addiction term? Because I understand that the sex addiction hasn't been admitted into the
Right.
DSM as of yet is sexual compulsive behavior. I'm just wondering what's the stance towards
It's
like
the
love
same
addiction
sort of divide. I would say
from
there's sort of
experts?
a side of the field that says absolutely, here's sort of the way we view it in models in which that support it as sort of a compulsive addictive behavior. And then the other side says absolutely not. I would say sort of that middle ground and understanding in terms of how clinicians view it is that it can be an out of control behavior, but we treat it more as something that is not as negatively viewed or perceived as something, you know, completely out of your control. I think the out of control sex and love model looks at it more as understanding it as sort of something that underlies, is driven by anxiety or early traumas, and has a bit more of a healthy sexuality model attached to that treatment. That was something I was seeing lacking in particularly the sex addiction model. There was a lot of, you know, adaptation to the sort of addiction, chemical addiction model of, you know, doing 12-step programs and sort of admitting this powerlessness over, you know, love and sex. And even though I see some value in that model, it was really missing the piece of healthy sexuality. You know, if we're abstaining from all things sexuality, how do we integrate that back into our life in a healthy way? So that was what really prompted my research. Does it exist? How do we work with it? And how can we give clinicians a better tool or resource on how to work with clients rather than just kind of abstaining from everything and creating more shame, which perpetuated the cycle in the first place, and giving them an understanding and accountability for their sexual and, you know, love behaviors that may just not be working for them. So language is really important, and also, you know, that providing that healthy sexuality model were really important in terms of how I work with sex and love addiction, as I put them in quotes, because whatever we call it, you know, I'm less concerned about what we call it and more about the experience that the individual has. And I find that most clients self-identify because they've read that and they've maybe taken an assessment online, 10 questions that says, yes, 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 okay, I must be a sex or love addict. And so there's so much confusion again around, you know, identifying as this thing that I have that makes me again feel powerless and broken, and that something's wrong with me, that if anything, I believe just creates a secondary trauma if we don't treat it properly.